I'm Kiersta Kurtz-Burke, and I'm a physician in New Orleans.
But your association with Charity Hospital then, though, was about 10 years?
Yeah. Well, Charity's actually been around since 1736. And it was started by the Daughters of Charity, some nice nuns who decided that all poor people should have access to health care.
It was one of the few hospitals of its kind?
It's actually the oldest continuous hospital in the country, and it's been continuously operated until Katrina since 1736. This building is from 1938, but the hospital has actually been on this site in one form or another since 1736. So
it mainly served the poor, low-income community?
Probably pre-Katrina, 85% of people that came through the doors, and we had 1 million ER visits a year, if you can imagine that. 85% of people who came through our door would have no insurance, so that meant completely uninsured. No Medicare, no Medicaid, no private insurance, 85%. And then another 15% would have either Medicaid or Medicare or Blue Cross, Blue Shield, something like that. But that's a pretty astronomical number, and it doesn't really exist. You know, this is a unique system, was a unique system in Louisiana. It doesn't really exist most places, you know. Who showed up to Charity 3 days after the storm from that hotel right there. She had been there during the storm, couldn't get to a hospital. She was like 17, she was with her mom, and she'd given birth. So she came, her mom had delivered the baby, and they walked through the water to Charity, and they were still holding the baby attached to the umbilical cord and the placenta.
Oh my God.
And the mom just carried the baby over her head, and the grandma carried the placenta, and as soon as she got there, she got antibiotics. Here she was, she'd just given birth and walked through this horrible water. But she did great, and the baby did great. The baby was really cute. Baby's name was Mariah.
How many days were you actually trapped in Charity?
6 days.
With about how many staff and how many patients?
We had overall, I think the numbers were about 600 patients, and then the rest were employees, and then employees' families, because people could bring in families. So we actually had the child care center on our floor, on the 5th floor. So we had 35 kids.
Oh, wow.
Ranging in age from 8 months to 18 years.
With no electricity?
No electricity.
No limited water?
Limited water. Actually, water was the biggest concern. Ramp is where we evacuated patients, and this was really like central for us because this is where we had a lot of meetings. We had prayer meetings twice a day. And as you can see, the ramp is higher, but right down there is a Superdome. So this is where we would stand and talk to people who were making their way through the water, and we would like throw them water bottles and stuff. And this is where we really got a lot of our information about what was going on in the city, because once the levees broke, we were completely surrounded by water, but this ramp was high and dry. And here, and people were making their way through the water, and we could see, you know, they had their grandmother on a mattress, and they had a couple kids in tires, and we would talk to them, flag them down, and say, where are you from, and how high is the water, and that's how we got a lot of our information. It was
just
really
from the
that
people
way.
walking.
Yeah. The thing that was surprising is even with our limited contact, by like Wednesday, we were already hearing, oh, the convention center is a disaster, there's no supplies, there's no doctors, there's no evacuation taking place. And then later on, when I read some of those transcripts of like Michael Brown on Wednesday night and Thursday saying, we don't even know there are people in the convention center, it was so incredible to me, because I was trapped in a building with no power, surrounded by water, and I knew the convention center was, you know, crazy. Early Tuesday morning is a big truck like that, actually a U-Haul truck, pulled up through the water and pulled up on this ramp and started unloading patients. They brought in 16 patients from a local nursing home, many of whom were on ventilators, and just dropped them off. Just left them. And I remember somebody coming up to my floor, the 5th floor, and saying, you know, we need help with these patients. We need people to ventilate them. And, you know, at the time, we thought it was like the most egregious, I mean, how can you do this to people? Like, this is horrible. And so taxing on the hospital already. We have all these sick patients to take care of. We don't have any power. We don't have any labs. We have limited resources. But in retrospect, I think I really, seeing what happened at some of the other nursing homes, I'm so glad that they did bring them here, because actually all of those patients survived.
Oh, that's beautiful.
Actually 3 people between Charity and University, the whole week, only 3 patients
That's
died,
amazing.
which is incredible.
Extraordinary.
Considering this was the highest volume of really, really critically sick patients.
So I guess there's a lot of emotions for you here, huh?
Yeah, and just a lot of emotions that it hasn't been reopened, you know. It's just like, you know, that's our floor, and I've been in the building several times. They actually have banned us from the building now. I can't go in. Keith Van Meter, who's just this doll, he's a wonderful person, an older ER doctor. He stayed, and he actually got some National Guardsmen and some German volunteers to help him clean up, and the hospital looked really good, and he said, he went on the news, and we're ready to open for business, you know. And this was when the city was still, you know, I mean, very deserted, desolated, but, you know, we just knew that people would come back to the city, and the administration made the decision that they would not allow that to happen. And in fact, they banned him, and they banned all the rest of us from the building.
And how many hospital beds are operational in New Orleans today?
I think only 400. And between University and Charity, we had 1,200 beds pre-Katrina. It's just heartbreaking to me, you know, that's how people are treated after. And I'm not even talking about myself, but people have worked there for years, you know. And a lot of people, I mean, lost this job. This job was also, they lost their houses. Some people lost their relatives. And I think in those first couple weeks after the storm, when we would all talk to each other, it was like that was the one thing that was keeping us going. Like, we're all going to be together again. We're going to be, you know, when you lose your job and you just lose your job, that's one thing. But for a lot of people here, most of the people here lost so many other things that it was like the job was the one thing that they thought, okay, well, at least I can go back to that. And at least I have that, and I've put in so much time and energy into that, and that's something that I've made good, you know. So that's painful. He was fired. Everybody was fired.
And that's been how long ago?
That was 2 months after the storm.
Wow.
So, you know, some of these are people that worked, some of the nurses I worked with worked here for 40 years. They never got a thanks for staying and taking care of patients. Thanks for your commitment service. They just got pink slips. And I think that's really painful. So painful.
Katrina's kind of given an excuse, you think?
It was the perfect storm. It was just like the perfect situation. That's why there's been so many battles about reopening Charity is they don't want to reopen something that a lot of people, a lot of politicians were against it to begin with, and so this was kind of the death knell for Charity. The water wasn't so high there. That was the one thing we could never figure out. There was a lot of traffic through here in those days. I mean, people walking, because, you know, it was about 4 feet or 5 feet, but people came by in boats, you know, like just people popped out of the woodwork. This one guy I met, he would come by every day. We'd see him go by bringing people to the Superdome just in his little, you know, homemade boat, basically, and started talking to him. He had fatigues on. I'll never forget this guy. He would stop sometimes to talk to us, and we'd give him water and stuff. He must have made like 50 trips back and forth. He was just going to individual houses and rescuing people. I started to talk to him, and he was from like a real small town in Louisiana. He was back on a 2-week break from Iraq.
Oh.
And he just saw what was happening on the news and got in his truck, put his boat in the back, and he worked for like a week just doing a lot of rescues. There were a lot of people that were just doing their own type of rescue.
Yeah.
The other thing, we could see huge helicopters all the time. I mean, it sounded to me like what it must sound like when they were in Saigon or something, you know. Chinooks and Blackhawks, and these Chinooks are enormous. You can drive like 3 Greyhound buses into it.
Oh my gosh.
So a Chinook actually came really close to University. We could see it coming down onto the roof, and they thought they were going to be evacuated. And actually what they did was, these are the only supplies that came into either one of these hospitals. They actually dropped off several large cans of ragu, which in glass jars that all exploded on contact. and half a dozen Krispy Kreme donuts. Like a half
in a helicopter big enough for three. What did you say? 3?
They came down for 3 Greyhound buses, I think, can drive. They came down real low, and they thought they were going to land. And my friend and some other people were up on the roof, and they were like, "Yay, this is it!" You know, they ragu, which exploded on contact because they didn't even get low enough to land. And a half of Krispy Kreme. And since they had like 1,500 people in the building, they were like, "Okay, we have 6 Krispy Kreme donuts. If we divide it into, I don't know, say 350 pieces a donut, you know,
with the raspberry jelly."
Yeah. So, I mean, they did say that they laughed because they were just so tired and hungry.
So good, little bit of comic relief.
A little bit of comic relief. Some guy from a small town in Louisiana can get in his boat, come in, you know, go and rescue people 50 times back and forth to the Superdome. I think it really was a lack of will. I mean, just the will to do it. And, you know, when we would be in contact with the EOC and FEMA and the National Guard, they would say, "Well, we just can't, there's no way we can do it." And it's like, we had, you know, taken the wires out of one of the Coke machines to try to hook the patient up to a hand ventilator. It's like, you know, everybody was doing things very creatively. It was like a lack of creativity. And I think it was a fear of a black nation. I mean, there's no way anybody's going to convince me that if this was downtown Boston, the Back Bay, you know, that it would have been different. They were afraid. I mean, I think that they were on an administration level. I mean, that's what they told us point blank. They said it's too dangerous. But the thing that was really frustrating is they started to say it's too dangerous, like on Thursday. Well, you know, things had deteriorated in the city to where there was violence happening. I mean, not nearly as much to what they actually, you know, reported. But they had let the situation deteriorate to the point where then they were like, now it's too dangerous. I mean, you take any city, any American city, I don't care if it's mostly black, mostly white, mostly rich, mostly poor, and you strand people in their houses and you cover it in water and you don't have an evacuation plan and you don't have a supply plan, and people are gonna, after 4 or 5 days, they're gonna lose it. I mean, they're gonna do everything in their power to get food. You know, anybody would do that. If your grandmother is trapped and you need to get her food and water, I don't care who you are, you're gonna do it. And my perception was actually that things were incredibly orderly. And I spent a lot of time here on the ramp. I spent a lot of time talking to people, going back and forth. There was not a lot of panic. You know, I was amazed at how calm people were when they were, you know, dragging their grandmothers and babies to the Superdome. I just did not perceive that, you know, it was like a, you know, crazy, you know, New Orleans black people gone crazy situation. Certainly not as crazy as Mardi Gras. I just think that it was a total lack of will. You know, if you can find a way around situations if you have the will, but if you don't have the will, if you don't think the people are worth it, then you're not going to make that next effort. You know, I mean, it's the military. The thing that shocked us was, you know, they came in and they were supposed to start. One of the many times evacuating us was on Thursday, and then there was this purported gunfire here from one of the rooftops, and they said, "We're leaving. It's too dangerous." Well, we're talking about, these are armored high water vehicles. These are soldiers in bulletproof vests, and they told us it was too dangerous. But we have 1,200 civilians, most of whom are critically ill, in this building. We could never figure out, if they thought it was too dangerous for the military to go in, how did they think it was safe for civilians and sick people to be here?
Aren't they trained for combat situations?
No. I mean, and it's like, you know, what about going into this, you know, supposedly they go into this building at Baghdad, a hospital, to get Jessica Lynch out, and they're being bombed at from, you know, and I'm like, okay, one thug with a gun is going to scare off the U.S. military? I mean, it really makes you afraid about how unprepared, if these are how unprepared our soldiers are, then how unprepared are they to go into Baghdad, right?
The wind blew so hard, Lord have mercy here. I said the wind blew so hard. Did you see the wind?